Now, the number of young children being infected and hospitalized with the new Omicron COVID-19 variant has spiked. And the National Institute for Communicable Diseases, Dr. Waasila Jassat, says they're concerned about how the virus has led to young children needing hospital care. I am now joined by the NICD's Dr. Jassat to give us more clarity and detail. Dr. Jassat, very good morning to you. Very, very concerning trend when it comes to this new variant. What do we know so far about, observing the number of young children coming in to be hospitalized?
Good morning. Thanks for having me. So certainly this is an unusual trend. In the first 3 waves, we didn't see children, especially very young children, affected as much with COVID-19. Despite children making up 30% of the South African population, they only comprise 12% of cases, 5% of hospital admissions, and less than 1% of deaths. In the third wave, we saw slightly more teenagers infected and admitted in hospitals. And now in the early part of the fourth wave in Tshwane and Gauteng particularly, we have seen more young children, particularly those under 2, admitted in hospitals with COVID-19 and indeed infected with SARS-CoV-2 virus.
Any sort of links and perhaps any ideas on where this sudden surge may be coming from when it comes to analyzing the patterns we've seen since tracking the trends of COVID-19?
So first, let me say that the pattern is changing, whereas, very young children under 5 made up 14% of admissions in the first week of the resurgence. They were 11% of all admissions in the second week and 8% in the most recent week. And so that very early trend of higher numbers of admissions in very young children is shifting a little bit. And there are more admissions now in those who are older, adults who are older. So it seemed quite alarming in the beginning, but it is shifting. But certainly it is still, kind of a higher proportion of young children admitted than we've seen before. So we've looked at the trends in previous waves. We haven't seen that before. But, having spoken to the pediatricians in the hospitals, having looked at the data, we do think this is not because of any changes in practices in the hospitals, in that they're just testing more children. This really is an indication of what is happening in the community. So there is more transmission amongst children, and there is certainly more young children needing to be admitted. Thankfully, for now, the data shows and the anecdotal reports show that the admissions across all age groups seem to be milder than they have been before, but it is very early days to be commenting on trends in severity, and I think we need a couple more weeks' data to be able to say more clearly.
Dr. Jassat, vaccines are not yet available to children under the ages of 12 years, but with these trends and, noting the under 5 age group becoming more and more at risk, what then does this message need to translate to when it comes to those who can get vaccinated?
So I think certainly from our data, from the Department of Health data that will soon be made public, most admissions in the hospitals are unvaccinated. From having spoken to clinicians in the hospital, both in the adult wards and the pediatric wards, most admissions are unvaccinated. And in fact, the very young children who are not eligible for vaccines, most of their parents are not vaccinated either. So there does seem to be a suggestion that vaccination does protect against hospital admission and severe disease, even though we're still waiting for data on immune escape that might be related to vaccines against Omicron. But certainly the anecdotal evidence and the data we have shows that you're much more likely to end up in hospital if you're unvaccinated. So I think it's a strong message to everyone to vaccinate yourself, because it's quite likely that vaccines will still protect against severe disease, even with the Omicron variant, and to vaccinate your children who are eligible, but to vaccinate so that you protect those around you who are not able to vaccinate, like our very young children who are not yet eligible.
And very lastly, what sort of contingency measures would you recommend then to households with children under the age of 5? So there's much more rapid transmission in the communities.
there's much more rapid transmission, particularly because there's mild and possibly asymptomatic illness out there amongst those that are vaccinated. So be watchful and vigilant for any symptoms. Remember also that children don't present typically like adults do with the respiratory symptoms. I mean, they do have cough and sore throat and fever, but many children also have diarrhea and vomiting as their earliest symptoms. So be aware that children's symptoms may be different, and speak to your health provider, your doctor, your GP quite regularly about your child's condition so that they can advise you on when a child might need admission. Most children have very mild disease with COVID-19, but those at risk with more severe outcomes are the very young, with those under 1 or 2 who have immature immune systems, and those with medical conditions. So if you have a very young toddler around, if you've got a child with a medical condition like diabetes, just be more aware of any changes in their condition, discuss it with your GP, and discuss when a child might need to be admitted to hospital.
Very well. Thank you so much for your time there. National Institute of Communicable Diseases, Dr. Waasila Jassat, giving some sound advice when it comes to some measures of protection to children under the age of 5. There, of course, admissions and COVID-19 infections being very high in that group and some concern around it.